Hi, Richard Finn, medical oncologist from UCLA in Los Angeles, here at ASCO 2025, presenting the data, long-term follow-up from the LEAP-002 study. This was a phase 3 study that compared Lenvatinib and pembrolizumab versus Lenvatinib and placebo. This was for advanced frontline setting. The overall endpoint from the study was PFS and OS, and unfortunately did not meet those endpoints. It was a very narrow miss. Specifically, we saw that Len-Pembro had a survival of just over 21 months, and surprisingly, Len provided survival of 19 months. If you look back at the REFLECT study, survival for Len was 13 and a half months. So sometime in the last 4 or 5 years, the natural history of these patients had changed significantly, which compromised the statistical design of the study, as well as some other aspects. But needless to say, the objective response rate was 26%, not too far off from what we saw in the phase 1b study, which was the rationale. There was no new toxicities with this study, mostly driven by Lenvatinib. But here, what we have is long-term follow-up. I mean, this is 59 months median follow-up, so just about 5 years. And you can see that the curves remain separated throughout this period of time. And looking at the 4-month benchmark, 23% of patients are still alive versus 14%. This is very consistent with the positive phase 3 studies that we've seen, for example, with durvalumab and tremi, which have long-term follow-up. And this was consistent across subgroups. We have no new adverse events. So provocative data. I mean, I think many of us feel this is an active regimen. The LEAP-002 study looked at Len, Pembro, and TACE versus TACE, and this was a positive study, improving PFS. And I think together, that data set and this data set together supports that Len, Pembro, is active in liver cancer, just finding the correct place to use it. Thank you for having me.